Hello my friends, today I'm with Elisa.
Hello.
She's Italian, but we're going to finally speak some English.
Of course.
And so what's the issue? Because you are 25 years old, you told me.
Yeah.
And what's the issue?
The issue is that I have strong pain in my back, more in the left than in the right, that is caused by a protrusion in L4 and L5 that push in S1. And I have this protrusion since 3 years.
Yeah.
From now.
You brought me some important exams because we have X-rays and we have an important MRI, and I can see an important hernia. So between the last lumbar vertebra, so the fifth one, and then the sacrum. That is an important issue because we are going to touch the root of the nerve of the sciatic, so of the leg. And then we have an important protrusion even on the L4, so the fourth vertebra, lumbar vertebra. So we have to treat the protrusion, distal protrusion, and then the hernia. So what about your job?
My job, I work as a cloud solution architect.
So
in
most of the time
yeah,
sitting in front of the computer.
Yes.
And what about sport that you practice?
I practice rollerblading and
nice.
yoga for the
yoga.
back pain. Yoga for the back pain.
Did you have any surgeries in the past or important traumas to tell me?
Not currently.
No.
Only this protrusion.
Perfect. In a scale between 0 and 10, how can you rate the
I
pain?
think 7.5.
Okay.
Almost
So it's a lot. Okay. That's interesting because she's shifting. You can see the body trying to protect this area. So she's moving all the weight on the right. And now please bend forward. Okay, try to reach the floor with your hands. Yeah, it's perfect. Okay, wait. You can come back up. Yes, have you seen? The thumb started to go upward before than this one and more than this one. It means we have a compensation. So I'm going to confirm that we have a compensation, postural compensation on the right. That's very important before to start. Do you feel pain if I do that right here? Just a little, right here? Okay, so try to keep in mind, okay, remember that. Here you start to feel the pain right here. Okay, I'm going to compare everything after the treatment. Okay. What about this one?
Less than the
other. Okay, interesting. Yes, we will start from this area. But before to approach this, I would like to warm up you a little. So I try to show you what you have to do.
Okay.
So you are going to trust me a little more. Let's start from the cervical. Okay, this is the first approach. Now same thing on the right. Okay, have you seen? It's very delicate, gentle, safe, and we're going to do the same because if we imagine that your hand is the disc, we have one vertebra and the other one squeezing the disc, and then it's going to cause the hernia. I'm just going to unlock that. So we're going to unload the weight you put on that vertebra. And we will start with this side because we have an important compensation and we're going to solve that. I'm going to check the fulcrum. So we have a compensation right here and one on the pelvis. It means that on the other side we'll have the hernia. Now let's start from here. Relax. Okay. Drop your legs. Yes, out of the bed. Yes, drop that. No worries. Just drop your legs. Yes. Perfect. More relaxed. Yes, once again. Okay. Have you seen?
Yeah.
No pain and it's right on the spot. Now second part. Because I have to work on the iliac bone. And then finally we can start to approach once we solve the compensation, the main issue. So try to drop your legs, both legs, yes, out of the bed. Perfect. Enough. Fantastic. Okay, we're ready. Now we are right here because she has the hernia right here inside. This is the spot. And this is the spot where you feel a lot of pain. Yeah. So now I'm going to open this space. Okay. I'm going to prepare everything for the technique. Yes, we are right on the right space. And now, perfect. Relax. Once again, drop your legs. Yes, drop it, drop it, drop it. Perfect. More relaxed. Okay, relax, relax. Perfect. Yes. Once again, relax, 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 relax. That's enough. Great job. Now, take your time. We're going to release the muscle, and then I have to make just the last approach on the leg bone. Drop your legs. Okay, more relaxed, more relaxed. Yes, once again, that's enough. Great job. And now I'm going to work on the second curve.
Okay.
Because we have 3 curves.
Okay.
Cervical, dorsal, lumbar, and we can talk about the pelvis too.
Okay.
Between the pelvis and the lumbar, we have our problem, but now we have to work on the opposite compensation of the dorsal spine. So it's a thoracic vertebra with a specific fulcrum, and it has its own fulcrum. We have to approach that. Try to relax as much as possible. Relax, relax, relax. Okay. Once again, little more. Okay. That's not easy. We have a little problem. So we have to find a solution. I try to move you a little. Okay. Drop yourself, relax. Yes. Okay.
Much better.
Much better. Lift your head once again. Okay. Now drop your body. Yes, it's perfect. It's perfect. It's perfect. Okay. Last one. Okay, that's enough. That's enough. We are going to finish our cervical approach. Okay. Relax. Perfect. Hold on tight to the edge right here. Yes. You can relax your hand. Now I'm going to pull strongly your hips.
Okay.
So relax. Yeah. Okay. Relax. Oh, very good.
Oh, this was so good.
Yes, so good. I agree. And now, let me check once again this side. Okay. It's on the right. Oh, okay, we got it. Perfect. Okay, that's the most important technique. Try to relax as much as possible. Turn your head on this side. Yeah. You remember the problem is right here.
Yeah.
Now we are going to open this space like a little lever right here. Yes, I need to work on this side because we are going to approach the left side, reducing the hyperlordosis you have there. So you're going to reduce the curve you have here. Does it bother you? Okay. As much I'm going to push here, as much I'm going to reduce the pressure you have on the root of the nerve. So the nerve root will release for that. Relax. Okay. Is it fine? More relaxed. 1, 2, more relaxed. Yes, that's fine. Let me check once again. That's fine. Last one. I have just a little impingement here and then it's fine. Let me check. That's enough. Yeah. Can you feel the difference?
Yeah.
What's the sensation right here?
light. Yeah.
Much lighter than before.
Much relief.
No pain.
Yeah, no
Yeah.
pain. No pain. Yeah, I feel very like
Relief,
I can fly.
yeah.
Yeah, relief. I have like a rock in my back. No, I don't have it.
Nice.
So it's
very
perfect.
good. And I would like to check something else.
Okay.
Lie on your back, please.
In a scale of 0 to 10, I think 4.
Okay, so much better. Just here.
0, just here.
Perfect.
Just here.
So it's a negative neurological
Yeah.
test.
0.
So there is no compression on the nerve root. I'm very happy.
I'm happy too. I can walk for
Yeah, now you can do whatever.
For a
I'm going
time.
to explain you everything.
Okay.
So while I will explain everything, just say goodbye to our friends. Thanks for watching. And bye bye.
Bye.
Thank you.